Clinic, I spoke to a couple and their doctor just before undergoing in vitro fertilization. It's been a 14-year journey that has finally brought them to Houston to see Dr. Sonia Christensen and hopefully get the family they so desperately want.
Any woman that's gone through my situation has to know how hard it is. I just get very emotional, I know. I guess it's maybe the 14 years of waiting to have a baby and the month after month just believing God that I'll be pregnant, and the disappointment of not being pregnant, and really just trying to figure out why am I not getting pregnant. My desire is to have a baby, and I feel like I need to have a baby. Any woman that wants a baby and they've never had one feels like an emptiness. It's almost like you have to feel it.
When I walk through, and what I'm thinking is, number one, make sure the patient's comfortable, the procedure is done safely, and then thinking, you know, this is right before we get eggs, and then we can start to create the embryos that they can eventually become pregnant with. It's like the conclusion of their journey that they've been going through for so long.
Please welcome Dr. Sonia Christensen, Medical Director of the Houston Infertility Clinic, and Reese and Tracy Klepach. Hi there. You're tearing up right now, and I don't understand what you're going through. I had a little bit of that fear because I had my son at 41 and I wasn't sure that I could get pregnant. And you and I were talking in the green room earlier. When that happens, you look at women who are pushing their babies in strollers, and it just it's painful.
It's really hard. I mean, it's extremely hard.
Yeah.
I mean, 14 years seems like forever.
Yeah.
And going through this, it helps a lot to have a place to go that can help you have a baby.
Yeah. You will find out later today whether you are actually pregnant.
Yes.
You got to be sitting on pins and needles, both of you, right now.
Yes.
Yes, we are. You always dream of being a dad. You always dream of being a mother. But I think the best thing on my side is, I'm going to find out that I'm a dad, but that I help to fulfill a dream and desire of my wife.
Yeah.
And that's going to be the best desire when we find out today.
All right, and the reason why we're saying you might find out later today is there's a procedure that you performed, and tell us what you did and who is a candidate for this.
Okay, we did an in vitro fertilization procedure, also known as test tube baby. And almost anybody's a candidate. Most women going through this are in their 30s. People who are in their 20s are still usually trying to get their careers and so forth, and so a lot of women these days are waiting until they're in their 30s or their 40s. And unless somebody unfortunately has run out of time, or they need donor egg or something, it's an option for anyone.
Yeah, and so what you're doing is you're taking her egg, his sperm, you fertilize it outside of the womb?
Correct. Remove the eggs. First we give her some medications to stimulate the growth of a lot of eggs. Very simple office procedure that removes the eggs, fertilize them with the sperm, have the embryos grow for a few days, and then transfer them back into the uterus.
Yeah, so you find out if it's viable. How do you decide which ones to pick? How do you decide how many to pick?
To basically decide which ones, we remove all the eggs because we don't know if they're good until they come out. Right. And it's removed through a simple, just a little needle stick, drains into a test tube.
Yeah, what we're looking at.
What we're looking at right now, and that's the ultrasound picture showing where the eggs are within the ovary. And then we drain it into this test tube, and then the embryologist will find the eggs, and all the eggs that are structurally normal and look good will fertilize. And then all the embryos that are growing normally, we will either place back in the uterus, or if they want, we can freeze for future use.
Yeah, so if it doesn't work on a cycle, that you can go back in.
We go back, very simple procedure with frozen embryos, yes.
Did you put in how many eggs?
I believe there was one.
Yeah.
One. I was hoping for more, but...
Yeah, she put back in one. It looked beautiful. It looked great.
How do you keep it together? And what advice do you have for other couples who've been through this struggle?
Well, I guess I'll let him answer that.
Keeping it together is the hardest thing. But I was brought up in a Christian home, and my wife was brought up in a good Christian home. And together it took a lot of faith and a lot of values. And that was that no matter what, we're a family. Whether we have children or we don't have children, we're a family. And it's hard to believe that for the past 14 years, we started off, because I am a pastor. We do travel a lot, as we were talking before, that we're children's pastors. So we always had kids in our lives.
Yeah.
And we always felt, that was our outside family. But the desire deep inside of her
It made
went
it worse
beyond.
for me.
Yeah.
And it made it worse for her.
Yeah.
So after all these years, we finally realized, the only way to make it work is through a lot of prayer and a lot of dedication to each other, and going beyond the point of having a baby and finding that real love that you have for each other.
And let me ask you, when should someone come to you? There's they say kind of after trying for a year is when we kind of say maybe there's some fertility problems. But should someone come to you even sooner than that if they suspect they might have a problem, or if they're a little bit older?
If they suspect they have a problem, past medical history, if they're 35 or older and they've been trying for about 6 months. And sometimes it doesn't take aggressive treatment. It can just be very simple. We just need to find the right diagnosis, a very minor manipulation of something. Not everybody has to go through in vitro.
Right.
And though all infertility treatments these days are very successful,
Yeah.
but
You just have to pinpoint a problem as early as you can and then get it over with.
Right.
All right. Thank you very much.
And thank you too.
Dr. Christensen's website is drchristensen.com, and there's a number to call right there on your screen. It is 713-862-6181. 713-862-6181, and we'll also have that on our website. Don't go away. We have lots more coming up.